Why do so many people hate statins? Let's break down the top reasons. I'm Dr. EvanLevine, board certified cardiologist. The biggest misconception, it's just big cash for big pharma. Reality, every statin we use today is generic. They cost pennies a day. In fact, people will spend $60 a month on unproven supplements while complaining about a $5 statin script. If someone is selling you a natural alternative for $50 or $60, they're the ones profiting, not big pharma companies. And let's be honest, some people are just lying to you. They use the anti-statin rhetoric to gain social media popularity or to sell you their own books and heart-healthy powders. Just follow the money. But what about the side effects? How about diabetes? Now, it's true that statins can raise your A1C by 0.3 to 0.5, and maybe for that borderline patient, it could push you into the diabetic range on paper. But here's an easy fix. Add fiber like psyllium husk to your diet, and you can lower the A1C by that same amount, effectively canceling out even the slightest statin effect while you keep the heart protection. People talk about hormones. I need cholesterol to make testosterone or estrogen. Now, while cholesterol is a building block, studies of people with genetic mutations that's born with low, very low cholesterol or high-dose statins with LDLs as low as 20 have perfectly normal hormone levels. Your body is very efficient at using what it has. There's the dementia thing. Now, there's a zero high-quality evidence that statins cause memory loss. In fact, preventing strokes protects the brain. But if you're truly worried, ask for rosuvastatin. It's hydrophilic, meaning it doesn't cross the blood-brain barrier and doesn't get into the brain. How about muscle aches? Yes, 10% of people get legitimate statin myalgia. It's real, but that means 90% don't. And how about sleep? Yes, some people do report sleep disturbances or vivid dreams. If that's you, we could change the statin or try something else. The biggest reason people quit? There's no high. Unlike an antibiotic that clears a fever or surgery that fixes a break, you just don't feel a statin working. And it's easy, very easy to ignore the benefit if you can't feel anything today. And finally, the one-size-fits-all mistake. Statins generally lower risk by 25%. If your 10-year risk of a heart attack is 1%, a statin only moves that to 0.75%. It may not be worth it to you. But what if your risk is 50%? That 25% reduction is massive, 12.5% absolute drop of chance of having a heart attack. Don't let a headliner supplement salesman decide your risk. Look at the data, check your calcium score, and talk to a doctor who actually knows the numbers. I hope